Hi, I'm Sue Mangold, and I'm from the State University of New York at Buffalo Law School. And I'm up here with my team because that's important to our research model. We're doing community-based partnership research to examine the relationship between sources, meaning federal, state, or local, the sources of the funding, and the type of funding, mainly focusing on whether or not the local agency has flexibility in the use of the funding. So the source of funding, federal, state, local, and the type, flexible or non-flexible, and how that impacts mental health outcomes for children in the foster care system in Ohio. So I'm going to introduce the project. Crystal's going to tell you a little bit about the funding structure in Ohio. Kate is going to run through the research methodology. Rhonda's going to talk to you about how some of the qualitative information we've gotten has flowed back into our model from the county directors of social services, and then I'll tell you about some of our disseminations so far. So to start off the project, we were looking at the wide range of funding structures available, not just in the state of Ohio, but throughout the country, and wondering whether that had any impact on mental health. We have 10 years of county-level data, both on finances and on outcomes for kids who have been in the child welfare system in Ohio, and we're doing both quantitative and qualitative work on that, and the actual design will be more detailed in just a few moments. We have adopted the outcome measures that the Department of Health and Human Services uses to assess state-level child welfare systems, and so they use as proxies for mental health well-being. How many days have the kids been in care? Can you reduce that? Can you reduce the days awaiting adoption? Can you reduce reentry into foster care? Can you reduce recurrent maltreatment? And so we've used those same outcome measures. But we did take the time to look back at some of the sort of landmark studies that made these connections, and they're actually not as clear as the HHS outcomes would lead us to believe. And so one of the things that we're finding in the qualitative aspects of our research is that the actual outcomes that are used perhaps should be studied, and they're linked to sort of kids' well-being after experiencing care. And we'll talk about that as we go along, but that may be something that it is something that we're adding into our project, as well as sort of a project for another day. So these are the three research questions that we're addressing. As I said, does the source and type of funding impact the outcomes that lessen behavioral health challenges? And again, those outcomes are days in care, days awaiting adoption, and we're also trying to look at recurrent maltreatment and reentry into care. What are the mechanisms for the associations? So if we find these connections, why does source and type of funding make a difference? And are those associations robust enough to hold true for African American kids who are disproportionately represented in the system in Ohio? So I'm going to turn it over to Crystal.
Well, in Ohio, the child welfare system is primarily funded by federal and local resources, as you can see. The state provides about 10 cents on the dollar, and actually the local resources are extremely inequitable, which means that if we have a county, there's 88 counties, if we have a county that invests in child welfare, then they have a fair amount of available resources per child population. If they have a county that puts minimal investment into child welfare, then that 10 cents on the dollar becomes the primary driving force. And our analysis shows that the available federal dollars is directly driven by the local investment. So the federal dollars don't go out equitably either. So we have 43 counties that have no local child welfare levy. That's the primary source of a local investment. It's a tax levy on people's proper, homes and businesses. 45 do have a levy. Now, they're in the more populous counties, so it's 80% of the child population versus 20. And I'll just point out, as you look at the map, you'll see the bottom, the southeast portion is Appalachia, and the northwest portion is fairly more wealthy rural farming land, and very, very conservative. We are a purple state, and that's a very red area of the state, just so you know. So there's very big funding inequities. We also are looking at the type of funding. Do you have flexible funding? Well, if you have the state funding that goes out 10 cents on the dollar is very flexible. Any child welfare activity you want to use it on, but it's only 10 cents on the dollar on an average. The county funding that's invested is also very flexible. Any child welfare activity you want. The federal funding is only available for placement or adoption services. And in child welfare, we feel like if we can provide safety services for families, then we can keep children in their homes or we can reunify them faster. And we see a better child well-being outcome with a shorter length of stay or not placement at all. So we also know that if we need to find a permanent home, having available resources matters quite a lot in terms of providing the ongoing adoption subsidies for families that are willing to adopt these special needs kids. So funding makes a difference. What's interesting is the federal government has a Title IV waiver project. This is the primary federal funding for child welfare. It's part of the Social Security Act. We are one of 4 states that have had a long-term Title IV waiver. It serves about 1/3 of our state, so some of the counties are under the 4E waiver, some of them are not. That gives them total flexibility of the federal dollar as well as the state and local. And we have had intense evaluations of this waiver. We see shorter lengths of stay, we see a greater rate of service to families without removing the child, et cetera. So, and interestingly enough, we see a lot of good practices that tend to be replicated in counties that are not part of the waiver. So the waiver seems to be a little guinea pig for the rest of the state to start replicating things. And in fact, we've had such good outcomes, the federal government allowed 10 more states to have Title IV waivers in recent years. So that's where we are in terms of our funding. Our hypothesis is that healthy outcomes improve when there is locally dedicated levy funds available to pay for child welfare services. Because the funding's flexible and reliable, this is another key thing, it's reliable because when the communities dedicate a local levy, it's for 5 or 10 years, they know their source of income and their level of income. It improves outcome. And then the same better outcomes apply when counties have flexible Title IV waiver funds, which are also very flexible and also very reliable. The way the waiver works, it's kind of like a block grant, not exactly, but kind of. So I'll hand it over to Kate. It's the right button, but you're on the right screen.
So the first thing that I want to say about our study team is this incredible opportunity for me to work with an interdisciplinary team, and community-based participatory research, for those of you who don't know, really means working with your community and the stakeholders to create the research questions, but also to design your study and the implementation of the study and to keep refining your methods. The theoretical framework that we looked at, this diagram puts together what everybody has said so far, really looking at system outcomes with the ultimate goal to improve the health of kids who are involved in the welfare system. Our early work, our preliminary analyses were largely bivariate and just trying to get a handle on the data in order to see whether this was worth exploring anymore. And when we first met and talked about this Protect Ohio and they weren't seeing the amazing results that they thought they might, and like Crystal said, some of the neighboring communities were doing well too, so there was sort of this transference happening between these local counties. We started to wonder whether if you had a local levy and the federal flexible dollars, did you have a double bang for your buck? Were you able to do more because you had more flexible funding? So we ran this basic analysis and looking at the difference in a few of our dependent variables. And in this one, it was quite remarkable that if you had no flexible funding, you were looking at a wait time for adoption of 2,716 days. And as you had more flexible funding, those wait times dropped dramatically. Well, of course, we know in statistics that there's many things that can result in a finding. Is it that those local communities have other things going on when they also have flexible funding? Do they build different partnerships? Are they able to train differently? What else is going on at the local level to be able to help find that out? because of community-based participatory research model, we wanted to be sure to do this in very careful steps and really have the county leaders be a part of our team. So we started with our quantitative analysis, which was very preliminary, looking at 10 years of data. We immediately brought our findings to a countywide meeting where all county leaders that could make it were present. We did 5 in-depth interviews, and we refined the quantitative model based on what we learned from our providers. The difficulty, as I said, with causation is if you're looking at does A equal B, what about C, D, E, F, and G, all that might be operating in that model and we don't really know about it, and are we getting sort of some spurious findings? And the interesting things that community leaders told us is going on in your model so much has to do with, as we all know in this room, other health indicators, poverty and availability of systems. These child welfare cases happen not only in the context of legal adjudication of cases, but also in terms of partnerships that form, similar to what you were seeing in your Connecticut study. So we created our first model with type of funding, percent of federal funding, amount of federal funding, cost per child, percent of child in poverty, and county size. The ultimate diagram looks like this with our dependent variables on the far right. And the first model was added to by our community partners. They added the cost per child because they were really interested in that themselves as county leaders, and also very interested in the role that poverty plays on these outcomes. We're very fortunate because we have a data set that goes almost 10 years. We were able to run a longitudinal model with multivariate analyses looking at average days in out-of-home care. That particular out-of-home care didn't really show anything over time related to our variables of interest. Median days awaiting adoption. We looked at, 3 of these analyses used GEE and 1 used just linear regression because it was normally distributed. When we look down our median days awaiting adoption, we start to see some interesting findings, and we're looking at county size having something to do with this in terms of smaller and larger counties placing quicker, and the medium-sized counties having a longer time in terms of waiting. In terms of funding, we're definitely seeing great impacts in our funding, with no sources of federal funding having a 99 longer wait date. If you have one type of funding, that drops down to 73 days. So we're really seeing a change in days. The one thing that came out interesting for our community partners was if you have more cost per child spent on some of these, you start to see decreases in the outcomes that you want in the right direction. But what does that mean in terms of services? A $10,000 per child increase in cost. One result was an 18-day quicker placement. Well, what does that mean to the child? Is it because the judge has a docket every month? Does it mean, what does that really mean? So we're looking at fleshing some of this out a little bit more. One of the things that we know is that some of this percent of kids eligible for adoption, it means that they're freed quicker, their parental terminations are happening faster, so even though the percentage of kids is going up and that might look like a bad outcome, it might mean that kids are being terminated quicker. Some of the limitations for us, of course, are that we don't have individual level data. This is county level data, so we can't account for kids coming through the system multiple times.
Kate's set a speed record there, I think. So the next part that we would like to talk about is how we proceeded with key informant interviews and the categories for those interviews. And there are some obvious ones about funding that I won't repeat, but there were some additional ones related to directors' career histories, dashboard and study data analysis, and you know, the federal and state local funding, how that was used, flexible dedicated funding. Leadership and authority is also something that we focused on. Just to mention, there were 5 key informant interviews, and there were extensive transcripts that were analyzed as a result of that. Is it the right button? Okay. Some things that emerged as a result of those key informant interviews, in addition to those other areas, coding was also done for topics that emerged related to child abuse prevention activities. terms that they use to describe funding, the lens of each interviewee. How are they approaching their work, philosophy of practice, and so forth. How did they determine success? What was their measure of success? What types of collaborations went on at the local level and their language for that? And then family-centered themes. And I kind of see that also as a philosophy of practice issue. One of the questions that we have out to the directors right now going into this next phase is, what variables should we be measuring in relationship to disparity? Is it just race, or is it race and something else? And perhaps in our discussion time, it would be really nice to get some feedback from all of you. They're thinking about it right now in preparation for our next phase. The current phase that we're in right now is analyzing the online surveys. They were completed in December. We got about a 70% return rate on those, and we're in the process of doing analysis right now. Into the winter and spring of this year, we're developing an approach to 30 in-depth interviews with county directors of PCSAs. And the surveys will provide data to us and give us some information to help us, the previous questions helped us determine the interview questions for these ongoing 30 surveys, and also the quantitative survey that was done. So let's see, wrap up? Okay.
This, you guys are over.
Okay, so this is our last slide. And so we had four phases to the project that's funded by the Public Health Law Research Program. Our quantitative analysis is ongoing, and as my team members have explained, we keep refining it as we present twice annually to the county directors. As we've gotten their feedback through the surveys, we keep refining our quantitative analysis, so that's ongoing. The key informant interviews that helped us develop the survey, those informant interviews are completed. The survey is completed. We're now analyzing the surveys, and those will help us develop the guidebook for our in-depth interviews of 30 of the directors, and that's what we'll be conducting in this last 10 months of our project and analyzing those. In the meantime, we've been writing up and disseminating our information, and we had a publication in the Journal of Health Law Policy, which was named one of the top 10 downloads. And we think that this is sort of an exciting development for community-based partnership research and for the public health law research that Robert Wood Johnson is supporting us all to do. So you see we have this big, long title that, if you're familiar at all with legal scholarship, is not the kind of sort of catchy, titles that are usually in law review articles, but instead I think the phrase is community-based partnership research. The funding questions and the outcomes for kids caught people's eyes, and folks are reading it. So hopefully we'll be back next year having completed our study with the findings that result. So thanks.
Thank you.